Hello everyone. In this video, I will be reviewing and discussing some at-home bleaching products. So most people these days are looking for a whiter or Hollywood smile, and sometimes the idea of going to your dentist for professional treatment either scares people, it shouldn't, but it happens, or they feel like it's out of their budget, so they want to try something more economical at home. Just a disclaimer, I have absolutely no stock in any dental bleaching products, and everything reviewed in this video I've bought with my own money. We'll start with probably one of the most commonly used whitening products, and that is whitening toothpaste. So whitening toothpaste don't typically contain any actual bleach, but they're abrasive. Think of them as a gritty polish that rubs the surface stain off your teeth. They're fine if you've got surface stains like coffee or mild staining, but don't expect a miracle because they're not an actual bleaching product. And if you've got sensitive teeth or gum recession, watch out for these because the abrasiveness can make it a little worse. My rating for whitening toothpaste is 2 out of 10. This one is courtesy of Pinterest. Baking soda and lemon juice. Please don't do this. Lemon juice is extremely acidic and will erode your enamel, and the thing that keeps your teeth white is enamel. So not only is it dangerous, but it's counterproductive. Don't use lemon juice, vinegar, or anything acidic on your teeth. Baking soda by itself is fine, within reason. Scrub gently once a week for a polishing effect, but don't go overboard. My rating for the lemon is 0 out of 10. And since we're on the topic of abrasives, activated charcoal does the exact same thing as polish or whitening toothpaste, with the difference that it's super messy. I've seen Instagram posts that say the charcoal sucks the stain out of the teeth and absorbs it. That's not possible, so don't fall for the marketing. If you're looking for an abrasive whitening method, I would stick to well-known toothpaste brands that have a lot to lose if their products are problematic, rather than pop-up stores on social media. Now we're going to move on to actual bleaching products. So no matter what bleaching product you hear about, whether it's at home, light activated, Zoom, whatever, the active ingredient is always the same. It's peroxide. It comes in 2 forms, hydrogen peroxide and carbamide peroxide. What makes these products different from each other is, first of all, the concentration of peroxide. Obviously, home treatments are going to have a lower concentration because you might otherwise burn your lips or gums if you're going to do it yourself. Second, what activates the peroxide and how long does it stay active for? For example, some formulas will have a peroxide that is actively bleaching your teeth for 40 minutes, while others might peak around 5 minutes in and then kind of break down after that, giving you a much weaker bleaching effect, even though the product was in your mouth for the same period of time. Another important factor is delivery method. If the bleach is slipping and sliding all over your mouth and getting diluted with saliva, then it's not going to work. If it's making contact with your teeth the whole time it's in there, it'll probably work better. And last of all, different formulations have things that can be beneficial for your teeth and prevent sensitivity, such as xylitol or neem oil. So let's get started. The first product I found at the drugstore was this bleaching pen, the Colgate Optic White. So the idea is you paint the bleach onto your teeth. This product is not bad. It tastes like mint, and it's kind of gritty, but I noticed that after 5 minutes, the taste is gone. Unfortunately, so is most of the product. It's really tricky to design a paste or gel that can withstand washing off with saliva. There are generally more effective products than this on the market, but it's not bad. My rating for this is 3 out of 10. Along the same lines of quick apply and mediocre results are bleaching mouthwash. Again, this is Colgate Optic White mouthwash, and this 2-step Crest whitening system, HD. Now the mouthwash is only working while it's in your mouth, so it doesn't really have much time to work. And with the 2-step system, there is actually peroxide in second step, which is more effective than just a whitening toothpaste. But again, it's just getting washed off with your saliva, so not the best in terms of delivery method. Again, the rating is 2 out of 10 for this one and 3 out of 10 for this. The 6th product I found is one of the most well-marketed products out there, Crest Whitestrips. They come in 2 clear sheets, an upper and a lower. So they look like this. You apply the longer one to the top teeth and the shorter one to your lower teeth. So what you want to do is you want to grab one, and first things first, you want to dry your teeth so it won't stick to a wet surface. So you have to dry your teeth, and then and you want to roll it around the back. Just like that, that's it. Repeat for the bottom. This is pretty good for getting around crowded or rotated teeth because you can actually manipulate it with your fingers around most curves. Look for the no slip label, which is called the Flex Fit, because the Crest Whitestrip Classics have a tendency of slipping around, so you can taste the peroxide more. This is my second favorite product on the market. It works very well for an at-home treatment. It does create a lot of sensitivity for some people, myself included. The sensitivity is temporary, but I have needed to take a Tylenol at times. So if you're prone to sensitivity, buy a milder formula and skip a day between treatments. My rating for this is 8 out of 10. The last product I want to review is the light activated bleaching tray. I've seen a company called Hi Smile all over Instagram. Crest now makes one of these with a light, retailing at about 125 Canadian dollars. The one I have is called the Brilliance Express. It's by Cinca. It comes with 4 syringes, 1 syringe per session. You deposit half a syringe on the bottom of the tray and half on the top of the tray. And you place the tray in and turn on the light for 10 minutes. The light is supposed to activate the peroxide particles to put them into a higher energy state and bump into your enamel more frequently to facilitate bleaching. It also vibrates to get the bleach into the areas between your teeth, so it can get around the curves better. I'm gonna try this in. So I'm gonna try it in. You're gonna take 1 syringe and you're gonna load half on the top, and you're applying it to the walls. You don't want to load the whole tray out, otherwise it'll just overflow everywhere and waste product. Just on the walls, and then flip it around and apply it on the bottom, again, just to the walls. Okay. I found this product to whiten my teeth better than any other at-home whitening product. I can't speak to the other brands of this light activated bleaching system. I don't know about their concentrations, and if they're on social media, again, I would be wary of their safety profile. But if they're similar, it's a great concept. I got sensitivity for about half an hour after bleaching my teeth with this, but no Tylenols needed and it went away quickly. If you don't like the sensation of the light vibrating in your mouth, I could see how it might be a little bit uncomfortable for you. One drawback is that this method does use a tray that is a stock tray. So that means that it's like a one-size-fits-all kind of deal. If your mouth is really small or you have a lot of crowding, rotated teeth, it may not be as effective for you as if your teeth are relatively straight, because there will be areas where the bleach just can't reach. My rating for this is 9 out of 10. So that's it. I've reviewed 7 take-home whitening products so you can decide which one you'd like to try for yourself. Please always remember to see your dentist beforehand to make sure you have no cavities or underlying issues before trying to bleach your teeth. You could cause some serious damage if you don't. Always clean your teeth before bleaching for best results. Remember that bleaching only whitens teeth, not crowns, bridges, or fillings. And have realistic expectations. At-home bleaching is a great option, but it usually won't get you the dramatic results that you get from high concentration bleaching done by your dentist. We use gum protectors, special glasses, and safeguards on you, so we can use those higher concentrations safely. Some teeth just respond better than others, and remember, the bleaching alone might not get you to the perfect snow white shade you see on movie stars. If you see that look, those are probably porcelain veneers. So don't be fooled and aim for perfection. See you next time.